I'm your host, Lisa Bruno. Joining us today is a registered dietitian, Rita Batheja. Welcome.
Hello. Hi. Thank you, Lisa.
Oh, you're so welcome. It's a pleasure to have you with us today.
Thank you.
Now, can you tell us a little bit about yourself and your work?
Certainly. As you say, I'm a registered dietitian, certified nutritionist in private practice, and I deal from pediatrics to geriatrics. My practice is in Baldwin Harbor in Long Island, New York. And Lisa, I'm involved with many things. In fact, I'm the reimbursement and legislative chair and membership chair of the complementary dietetic practice group of the American Dietetic Association. I'm a New York State networking coordinator of the Vegetarian Nutrition Dietetic Practice Group. I am a reimbursement chair of the New York State Dietetic Association. In the last year, I was a diversity chair and have taken the various positions. I'm also reimbursement chair of the Long Island Dietetic Association.
Wow, you have been working hard.
Yes, I do, and I'm the founder of the Indian American Dietetic Association, and I was appointed by the president of the American Dietetic Association to serve on the legislative state issue task force.
Oh, well, that's incredible.
Thank you, Lisa.
So I was hoping that maybe you can enlighten us a little bit about type 2 diabetes.
Yes.
It's becoming such a big epidemic in the United States.
Mm-hmm.
Can you speak to that concern?
Oh, certainly. Actually, as I would say that diabetes, is epidemic, Lisa. And I don't know if you know, but there was a study done actually in 2004, and it was published in the Journal of the American Cardiology, and they said that diabetes is like epidemic, and more people are getting diabetes, and Indians are the culprit most in the world than any other ethnic communities, and even the Hispanics and the whites. And we don't know why. It may be genetics probably.
Wow, well, that's wonderful
Yeah.
that you are on top of
Yes.
this very important issue.
Yes, and I forgot to mention that also I serve on the we have a Diabetes Coalition of the Long Island, and I sit on the committee, and I have served with the American Diabetes Association, American Heart Association, and American Cancer Society also.
Well, that's incredible. That's incredible. Now, in regards to diabetes, I know often people are confused between the difference of type 1 and type 2.
Right.
Can you clarify that for us?
Sure. What happens, Lisa, with the type 1 diabetes, your body is not producing insulin. So people who have type 1 diabetes, they must take insulin. As far as type 2 diabetes is concerned, that's where the body does produce insulin, maybe producing inadequate amount, and your body may not utilize it properly. And this way what happens that the glucose metabolism is disturbed and you don't get adequate energy. So this is what type 2 diabetes is.
Well, thank you very much.
You're welcome.
Now, it seems that everyone knows someone with diabetes. And what can we do to avoid this disease?
Lisa, before I go into that, I also want to mention that people who have diabetes, many times they are walking and talking and they don't even know that they have a diabetes.
Oh, that's scary.
It is, in fact. And what happens that, if they eat, the less refined carbohydrate, the sugar, simple sugar, if they are exercising, or if they do, something of everything, like many people who have arthritis or something who cannot do the exercise, there is an exercise band available where they can do the gentle exercise. There is also something called yoga. There's in the complementary therapies, like there's one of the modalities. That's where, if you practice certain of those things, there is a stress. Like, we are just full of stress.
Yes.
24 hours are not enough in one day.
Yes.
So what happens that, we need 26 to 28 hours per day in order to finish our work. So that's why it's very important, like the meditation and all, as I just believe. And there are a lot of patients and a lot of medications. And I'm more into the complementary therapies, coming from the Eastern countries.
Yes.
That we don't have to be changing ourselves because we are brought up believing in natural therapies. Like example, in India, I come from India, and you just believe that have cinnamon or have you can have fennel seeds, any set actually, and those things do bring your blood sugar down. Example, you can have a half a teaspoon of cinnamon. They can throw it on the yogurt or in their cereal. And fennel seeds we use as the mouth freshener after meals. So these are some of the things that they
lower
want
your
to
blood pressure.
exactly everything. In fact, yeah. The garlic is also that which helps bringing your cholesterol down, as they say. So some of these spices and herbs which you want to incorporate into the daily, the food habits.
Yes,
basically.
yes.
And as I just said, drink adequate water. And obesity is again another epidemic. So you have to keep your weight down, by practicing. And they say that more, eat less, and that makes perfect sense.
That does.
It's like, and they do need to make like lifestyle changes for lifetime.
Yes.
And also another thing, Lisa, that how they are going to help, avoiding this, epidemic is at least once a year, this is my suggestion, that they should go to the physicians for the prevention. Because there are a lot of people, they will just wait to get some kind of symptoms, and there are times you don't get any symptoms. So it's very, very important
Yes.
that once a year, and as we say, that MDs and RDs, RDs stands for registered dietitians, that they work in the partnership. I just tell my patients that go to the physicians, and if you find out if you have a diabetes, tell your physicians to refer you to the registered dietitian, to the endocrinologist, or any specialist. In fact, it could be podiatrist, it could be dentist, it could be ophthalmologist. So it's like, all the disciplines working together.
Yes.
And many people will feel that if you have insurance, it's not like health insurance, it's not like a car insurance that if you will use it, it's going
Only
to go
when
up.
something goes
Go
wrong.
up. You
Right.
don't want that.
Right,
So
right.
if you have the insurance, make sure. And even if you don't have insurance, you spend so much money on the other things. So set your priorities right. So this is what I would say, that
you,
comes
Rita.
into the picture.
That's very valuable advice. Very valuable.
Thank you.
And I understand in your incredible journey that you've met President Clinton and Senator Clinton. Would you mind telling us a little bit about that experience?
Not at all. In fact, I feel that he was such a genuine when I met him, just to looking at him. And the reason I met him was I was thanking him because he was the first president who signed the bill that patients who have Medicare, who can go to the registered dietitians, for the MNT, and MNT stands for Medical Nutrition Therapy. So that is covered under the Medicare. And I encourage, everybody to do so, those who are the senior people, that it is necessary. And still a lot of people are not aware of it, that this benefits, and that made possible by President Clinton actually.
Right.
And as far as the Hillary is concerned, the senator I met because of the cardiovascular disease. So I'm working with her based on to incorporate the cardiovascular disease and certain other diseases like obesity and all to be incorporated into the Medicare.
Oh, that's wonderful.
Yes,
It's really wonderful
yes.
to hear
And
how
they are
involved
very dedicated.
they are.
They are
Yes.
very dedicated as far as the healthcare is concerned.
That's
That is their
incredible.
top priority.
That's wonderful. And thank you to our guest, Rita Batheja, MSRD CDN. We have a lot more great topics to talk about, so please come back and visit Beat the Disease Nutritionally.